Hey everyone, this is Dr. Jump. You can find me at anatomyonthego.com. So if you found me on YouTube, feel free to bounce over there and check out the content that I have created and am creating as we speak. So this is video 2 in a multiple video series where I describe the muscles that attach to the scapula. So muscles are attaching in some way, shape, or form. So they could be an origin or an insertion. And if those two concepts make no sense to you, they will shortly in a later slide. But basically, long story short here as well, I love this stuff. I think it's fascinating. I love all of anatomy, physiology. But I find that students are often kind of overwhelmed by it, and they want a bunch of help. They want to break it down into smaller chunks. And then students often learn in various ways, including video, podcast, or i.e. audio file, or looking at the content in front of them, i.e. reading it, talking to people. So I'm trying to create content that appeals to those learning styles as well. So I'm trying to help you out here. Feel free to connect with me if you'd like me to create something specific for you to help you. So what we'll do in this video is I'll first review the muscles that I talked about in video 1. Then we'll talk about specific landmarks on the scapula, and I'll talk about the muscles that are attaching to these landmarks. Then we'll review, and then we'll practice the content that you learned in this video. So in the previous video, we talked about several muscles that we can see in this particular image. We talked about trapezius, deltoid, teres minor, teres major. We also talked about rhomboid major and rhomboid minor that you can see in this image. So we mentioned how trapezius, basically it attaches medially along the spine, and it inserts on the acromion and the spine of the scapula. Among other actions, the trapezius elevates the scapula. So if you go to the gym and do shoulder shrugs, you are activating, you're working your trapezius. And then we also talked about the deltoid muscle. Has similar attachments to the trapezius, the acromion, the spine of the scapula. And this muscle is responsible for various actions, including abduction, that's pulling your arm to the side, and also flexion and extension at the shoulder, moving your arm forward, moving your arm backward. The deltoid muscle performs those actions too. Then we also talked about teres minor, and we talked about teres major. Teres major's larger. It's located inferior to teres minor. Teres minor we'll see later is part of the rotator cuff muscle group, and teres major plays a role in rotation and moving the arm toward midline. So rhomboid major and rhomboid minor, as indicated by the blue circle there, that's rhomboid major. It's bigger, larger overall, and located inferior to rhomboid minor, which is superior to it, indicated in blue just above the red muscle, the rhomboid major there. So these two muscles act to retract our scapulae, pull them backward and toward midline. So if you go to the gym later today and you get on a rowing machine, you're working the rhomboid major muscle to pull, basically to row, to perform that rowing motion, retract, pull back on your scapulae. So let me add some landmarks to you, and again, head over to my website if you like, and I have all these different landmarks pictured and indicated, and also some quizzes to help you learn these landmarks for the scapula and other bones as well. So let's talk about the supraspinous fossa. The next 3 landmarks are simply just named for where they are on the scapula, and this landmark here in particular is named for its relationship to the spine of the scapula. So again, if you're looking at the spine, you know right away that you're looking at the posterior scapula. And so the supraspinous fossa is simply just superior to that spine. So this is a superior view in the image to the right. Here's a wider view of that same view there. And then you can also see it from this view. This is a posterior view. And so you can see that fossa is simply just above or superior to the spine. We have another fossa called the infraspinous fossa. It's called that simply just because it's inferior to the spine, so we call it the infraspinous fossa. There's the spine again, that horizontally coursing structure. And then remember, as soon as you see that, you know right away, okay, posterior scapula. Wider view of the infraspinous fossa. Then we have this structure called the subscapular fossa, named for its location underneath the scapula or beneath the scapula. So in our bodies, the superior aspect of the scapula tilts toward the front compared to the inferior aspect of the scapula. So this fossa, which is located on the anterior surface of the scapula, is under or beneath the scapula, so we call it sub. So note that it's on the same side as well as this thing called the coracoid process, which is a great anterior landmark. And so that's the structure that almost looks like a beak that's above or superior to the circle there in this picture. So if that doesn't make great sense, feel free to head over to my blog and check that out too. And I have some videos that describe that as well. So there's a wide view of the subscapular fossa. Again, you're looking at the anterior surface of the scapula there. So these videos are describing muscles that attach in some way, shape, or form to the scapula. So that could be the origin of the muscle that's attaching to the scapula, or it could be the insertion. But in general here, we have an origin. This is where a muscle begins, and this is the part of the muscle that is fixed or static. It doesn't really move. It's like the anchor point. Whereas the insertion is the part where part of the muscle, the attachment of the muscle, where the muscle ends, basically. This is the part that is actually moving another body part, another bone, away from the body or toward the body or rotating it. So origin, fixed, insertion, movable. So the supraspinatus. So you'll find that these next three muscles that I'll describe, actually 3 of the 4 muscles I'll describe next, are simply just named for what they're attaching to on the scapula. So they're very straightforward, right? And many muscles are like this. As you learn anatomy, you'll see that the name is basically just describing what they're attaching to or where they're located in general. So we have the supraspinatus muscle. The origin is the supraspinous fossa, and then it inserts on the greater tubercle of the humerus. So this is a point on the proximal part of the humerus, basically toward the shoulder joint. The action here is to stabilize the shoulder and to abduct. So that is to pull the arm away from midline. So abduction, in this case, we're talking about the initiation of abduction, and then the deltoid muscle that you saw in the previous video will take over from there. There's the supraspinatus. So notice location superior to the coracoid process, and so we're basically the origin here is the supraspinous fossa. Infraspinatus simply just attaches here at the infraspinous fossa. The insertion, just like the supraspinatus, is the greater tubercle, the roughened portion, proximal part of the humerus on the arm. The action is to stabilize the shoulder, and it's involved in lateral rotation. So I'd like you to just try this wherever you're sitting listening to this video. Put your arm to the side, and then bend your elbow and bring your forearm toward your arm. And so then move your hand towards your body, and then move your hand back to where it came from. So moving your hand towards your body is medial rotation, and then moving it back is lateral rotation. So the infraspinatus, is involved in lateral rotation. There it is again. So notice location inferior to the spine of the scapula. Teres Minor there. The origin is the lateral border of the scapula. The insertion, just like the other muscles here, is on the greater tubercle, on the proximal part of the humerus, which is the arm, just near the shoulder joint. It stabilizes the shoulder as well, and it's involved in lateral rotation. There's the Teres Minor. So it is inferior to where the infraspinatus is located. Subscapularis, again, here we go. Easy name. It simply just attaches at the subscapular fossa. The insertion in this case is on the lesser tubercle of the humerus. This is a tubercle that's just next door to the greater tubercle on the upper part of the humerus, which is the arm. It stabilizes the shoulder, and it's involved in medial rotation and also adduction. So note that I said just adduction. I didn't emphasize the AB, which is movement away. In this case, rotation toward the body and bringing the arm toward midline. So there's the subscapularis, and note its location inferior to the coracoid process. So the rotator cuff muscles collectively are supraspinatus, infraspinatus, teres minor, and subscapularis. The overall actions here are basically to stabilize the shoulder, to raise your arm, and then to rotate your arm. And so in this case, we can talk about either medial rotation or lateral rotation of the arm. So they basically wrap around the top part of the arm and do these or perform these actions, almost like a cuff wrapping around the upper part of the arm. So let's practice. You can take a look at this question. We'll have a little bit of a pause, and then I'll give you the answer to the question. So which of the following muscles attaches to the supraspinous fossa? Pretty straightforward, eh? So that's A. Question 2. Which of the following attaches to the lateral border of the scapula? You got it. That's C. Question 3. The blank is responsible for medial rotation of the arm. Subscapularis. Okay, let's identify some of these. Now identify the muscle indicated by the blue arrow. Supraspinatus. So attaches to the supraspinous fossa. Which muscle is that? Teres Minor. One of the rotator cuff muscles as well. And identify this one. Infraspinatus. Okay, so today we talked about 3 brand new muscles, and we brought in a muscle that I talked about already in video 1. You learned about supraspinatus, infraspinatus, and subscapularis. And we talked about how we have 4 rotator cuff muscles: supraspinatus, infraspinatus, subscapularis, and teres minor. So resources on my website, you can learn the entire skeleton. I have blog video content for tips for learning anatomy, also skeletal muscle anatomy. I have a podcast, and I'm creating new content for that podcast. And if you'd like me to podcast on something particular, please let me know. On Facebook, you can message me if you'd like to connect to my website as well. And I'll keep posting questions, tips, live video, etc. for you. And feel free to connect. I hope this video has helped you. Break it down into a smaller chunk, more manageable portion for you to understand. Keep at it, and let me know if I can help you. Take care.